Eye movement desensitization and reprocessing, or EMDR. It's kind of all the rage these days, and so maybe you've wondered, where did it come from? What is it? What's it do? My name's Joe, and I'm a licensed mental health counselor and also an ordained Christian minister. So my perspective on these topics is shaped by a worldview that says God cares about you and the way that you engage those troubling, even traumatic memories from your past. Now, this is not a training in EMDR, and this is not an EMDR therapy session. This is just a brief introduction, especially intended for you if you're one of my clients and if we're about to embark on some EMDR therapy. EMDR was discovered and then tested by Francine Shapiro. Essentially, what Dr. Shapiro stumbled upon was that doing eye movements that mimic REM sleep actually led to a reduction in the disturbance of troubling thoughts and memories. The first controlled study was conducted in 1987 and was published in 1989 in the Journal of Traumatic Stress. The study involved men and women diagnosed with PTSD. These were war vets and sexual abuse victims, and the study showed dramatic improvement over time as compared to the control group. Since then, EMDR therapy has been demonstrated to be effective for treating trauma in randomized clinical trials, case studies, millions of clinical hours treating trauma and trauma-related disorders across the globe. So how and why does it work? Well, our brains have a way of processing information whereby the stuff that's helpful for learning and growth gets stored, and the other stuff that's not helpful, the brain just lets go. Sometimes, however, we experience traumatic or disturbing events that overwhelm the processing system, and therefore the experience doesn't get fully processed and stored like other memories. It gets stored in an emotionally active state, influencing our daily lives without us even necessarily being aware of it. The solution is to find a way to fully process those unprocessed traumas so that those memories can move to the helpful file cabinet that our brains put the other less traumatic day-to-day problems in. And EMDR has proven to be an effective tool at doing just this. So to prepare for EMDR sessions, the counselor and client, they will discuss the memories that might need to be focused on in future sessions. And the goal is to guide the client's brain in processing the traumatic memory. Now, this is where the eye movements come in. Some therapists have clients follow their fingers, or they use tools like light bars or hand buzzers, or even alternating tapping on the knees or in what's called a butterfly hug. This is called bilateral stimulation, and it mimics what's happening during REM sleep when your brain is doing the normal processing of the day's memories. Now, that was a ton of info in too short a period of time, so probably not very helpful, but I'll say this from my own experience if you're somebody interested in exploring this kind of therapy for yourself. As a client, I experienced how quickly this process helped me to reframe and reach new, healthier conclusions about painful memories. And as a practitioner who is trained in and utilizes EMDR, I'm continually blown away watching the client's mind work to process even the most disturbing traumatic experiences and having them come back reporting feeling lighter and no longer triggered in the ways that they had been before. If you're interested in learning more, you can head to emdria.org for articles and more. And if you're interested in working through some traumatic or disturbing memories or phobias, reach out to an EMDR trained counselor like myself or one in your area and see if this might be a therapeutic tool that works for you. See you in the next video.